Together we achieve victory over heart failure.
Hello, I'm Dr. Varun Sharma. I am a consultant chief cardiologist at Padhe Hospital and Heart Center, Agra. Today, I'll be talking about heart failure, a few valuable insights I'll be giving about heart failure. So, as we know, heart failure is an epidemic which has spread all across the world. And even in India, also, the prevalence is more or less around 1 in every 5 individual. So, it's spreading like fire in India also. And most of the people are ignorant about heart failure. They don't know what are the symptoms of heart failure. And when they present to us, they're already in the advanced stages of heart failure. So it is very pertinent to start early and get it diagnosed at an early stage so that it can be handled and treated properly. So, what are the symptoms to start with? So, the symptoms can be variable. It can start with complaint of breathlessness, that is dyspnea. There can be feeling of fatigue. There can be swelling of the body, swelling of legs, swelling in the eyes, swelling of the abdomen. Then there can be other symptoms like coughing. There can be other constitutional symptoms like fatigue, as well as sometimes there will be symptoms of nausea, anorexia. All these symptoms can be the symptoms for heart failure. So, whenever the patient is having any of these symptoms, they should visit their nearest cardiologist and get them evaluated. So, the basic investigations for heart failure would be a simple ECG, a 2D echocardiogram, some blood tests like a proBNP, and some relevant tests, some other relevant tests. And after all these tests, the patient can be categorized as heart failure patient. Now, it is divided broadly into two categories: heart failure with preserved ejection fraction and heart failure with reduced ejection fraction. So, patients having an ejection fraction less than 40%, they are categorized as patients with reduced ejection fraction. And patients having ejection fraction more than 50% will be categorized as heart failure with preserved ejection fraction. The mid-range EF, that is between 40 to 50%, they will be categorized into the third category, which we call as mid-range ejection fraction heart failure. So fortunately, we have very good drugs now, which can be started early on in the treatment, and the patient can be very well managed with these drugs. And most of the patient, approximately 80 to 90% of the patient, improve with these drugs only. Some patients who are refractory in refractory stages or refractory heart failures, for those patients, we require some advanced treatments like devices like CRTs, ICDs, and even left ventricular assist devices in very few of the patients. So the crux of my discussion would be like I would be saying that whenever the patient has these symptoms, like they have risk factors like diabetes, hypertension, history, familial history of dyslipidemia, family history of coronary artery disease, they should get themselves evaluated from their nearest doctor and get the treatment started as soon as possible so that we can fight against the epidemic and get it treated very effectively. Thank you.